congenitally corrected transposition of the great arteries. We'll just call it CCTGA to save some time. In CCTGA, the position of the right and left ventricles are switched or reversed. Now, this might not look like a big deal in this diagram, but it is. Let me explain. Remember when I told you that the left ventricle is the stronger of the two pumping chambers? Well, in CCTGA, the connections between the atria and the ventricles are abnormal. You have the stronger left ventricle doing the easier job of pumping blood to the lungs. At the same time, the weaker right ventricle has to pump blood to the entire body, a job it just wasn't designed for. To make it even more complicated, the connection between the ventricle and the aorta and the ventricle and the pulmonary artery are also both abnormal. Specifically, the left ventricle is now connected to the pulmonary artery and the right ventricle is connected to the aorta. So the blood is flowing in the usual way, but the mechanics used to pump the blood are very different than the normal heart. Over time, the right ventricle can become weaker, leading to heart failure.